Right now, when you see your healthcare bill for 2000, for if those of you who are on the market, you're going to see that they go real high. But they've also allowed something, cheap insurance. You remember those insurance policies that you could find and it looked like it was too cheap, but you couldn't help but buy it because you got insurance now and it costs a lot less than the others? Trump allowing that back onto the market. What it really means is that you'll have coverage that isn't worth the paper it's written on. The health insurance market is a mess. Trump has destroyed it. And he's used every loophole in the Affordable Care Act to bring in products to destroy it. And you have to be careful of what you're buying. Because here's the problem. At any given time, most people are healthy, right? They don't get to use healthcare in a very major way. So at any given time, you'll only have, let's say, 10, 15, 20% of people that are going to notice how bad the policies are that they're purchasing. I can sell millions of junk insurance policies, and it's okay if 10 or 15 or 20% of those people have problems. You know why? It's not enough to mess an election up. And for those who didn't use the insurance and only had to pay a cheap price, for them, hey, they only paid a cheap price. Now, remember, if 100 people are using insurance, 20% and all of that 100 people buy junk insurance, and 20 of those people get sick. There are 20 pissed off people because they realize insurance is junk. But there are 80 people that are not pissed off. And they're not pissed off because if they had real insurance, they would have spent a lot more than they're spending right now. So they got a break because they didn't get sick and they bought junk. So they didn't get a chance to feel bad about buying junk, but they still saved money. But because we don't know who specifically is going to get sick, nobody should have junk insurance. But those 80% that bought junk insurance and didn't have to use it are happy because in reality, they did save money. And that is why you need single payer healthcare for all, because that is why you have to have a system where everybody has the same skin in the game, proportionally that is, because then nobody feels cheated. You see, I tell you something, that person who bought that junk insurance policy that didn't have to use it, and that person who bought the expensive good insurance that didn't have to use it, the person who bought junk feels, hey, I got me a deal. The person who was responsible and bought important insurance, they sit down and said, damn, since I didn't get sick, I should have just bought the junk. That's why we need complete nationalized single payer healthcare.